221. The nurse is performing an initial assessment of a newborn Caucasian male delivered at 32 weeks gestation. The nurse can expect to find the presence of A. Mongolian spots, B. Scrotal rugae, C. Head lag, D. Polyhydramnios. 221. Answer C. The infant who is 32 weeks gestation will not be able to control his head, so head lag will be present. Mongolian spots are common in African infants, not Caucasian infants. The client at 32 weeks will have scrotal rugae or redness. There is no alteration in the amount of amniotic fluid, therefore, answers A, B, and D are incorrect. 222. The nurse is caring for a client admitted with multiple trauma. Fractures include the pelvis, femur, and ulna. Which finding should be reported to the physician immediately? A. Hematuria, B. Muscle spasms, C. Dizziness, D. Nausea. 222. Answer A. Hematuria in a client with a pelvic fracture can indicate trauma to the bladder or impending bleeding disorders. It is not unusual for the client to complain of muscle spasms with multiple fractures, so answer B is incorrect. Dizziness can be associated with blood loss and is nonspecific, making answer C incorrect. Nausea, as stated in answer D, is also common in the client with multiple traumas. 223. A client is brought to the emergency room by the police. He is combative and yells, "I have to get out of here. They are trying to kill me." Which assessment is most likely correct in relation to this statement? A. The client is experiencing an auditory hallucination. B. The client is having a delusion of grandeur. C. The client is experiencing paranoid delusions. D. The client is intoxicated. 223. Answer C. The client's statement "they are trying to kill me" indicates paranoid delusions. There is no data to indicate that the client is hearing voices or is intoxicated, so answers A and D are incorrect. Delusions of grandeur are fixed beliefs that the client is superior or perhaps a famous person, making answer B incorrect. 224. The nurse is preparing to suction the client with a tracheotomy. The nurse notes a previously used bottle of normal saline on the client's bedside table. There is no label to indicate the date or time of initial use. The nurse should A. Lip the bottle and use a pack of sterile 4x4 for the dressing. B. Obtain a new bottle and label it with the date and time of first use. C. Ask the ward secretary when the solution was requested. D. Label the existing bottle with the current date and time. 224. Answer B. Because the nurse is unaware of when the bottle was opened or whether the saline is sterile, it is safest to obtain a new bottle. Answers A, C, and D are not safe practices. 225. An infant's APGAR score is 9 at 5 minutes. The nurse is aware that the most likely cause for the deduction of 1 point is A. The baby is hypothermic. B. The baby is experiencing bradycardia. C. The baby's hands and feet are blue. D. The baby is lethargic. 225. Answer C. Infants with an APGAR of 9 at 5 minutes most likely have acryocyanosis, a normal physiologic adaptation to birth. It is not related to the infant being hypothermic, experiencing bradycardia, or being lethargic, thus, answers A, B, and D are incorrect. 226. The primary reason for rapid continuous rewarming of the area affected by frostbite is to A. Lessen the amount of cellular damage. B. Prevent the formation of blisters. C. Promote movement. D. Prevent pain and discomfort. 226. Answer A. Rapid continuous rewarming of a frostbite primarily lessens cellular damage. It does not prevent formation of blisters. It does promote movement, but this is not the primary reason for rapid rewarming. It might increase pain for a short period of time as the feeling comes back into the extremity, therefore, answers B, C, and D are incorrect. 227. A client recently started on hemodialysis, wants to know how the dialysis will take the place of his kidneys. The nurse's response is based on the knowledge that hemodialysis works by a. Passing water through a dialyzing membrane. B. Eliminating plasma proteins from the blood. C. Lowering the pH by removing non-volatile acids. D. Filtering waste through a dialyzing membrane. 227. Answer D. Hemodialysis works by using a dialyzing membrane to filter waste that has accumulated in the blood. It does not pass water through a dialyzing membrane, nor does it eliminate plasma proteins or lower the pH, so answers A, B, and C are incorrect. 228. During a home visit, a client with AIDS tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? A. Administer an antibiotic. B. Contact the physician for an order for immune globulin. C. Administer an antiviral. D. Tell the client that he should remain in isolation for 2 weeks. 228. Answer B. The client who is immune suppressed and is exposed to measles should be treated with medications to boost his immunity to the virus. An antibiotic or antiviral will not protect the client, and it is too late to place the client in isolation, so answers A, C, and D are incorrect. 229. A client hospitalized with MRSA is placed on contact precautions. Which statement is true regarding precautions for infections spread by contact? A. The client should be placed in a room with negative pressure. B. Infection requires close contact, therefore, the door may remain open. C. Transmission is highly likely, so the client should wear a mask at all times. D. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. 229. Answer D. The client with MRSA should be placed in isolation. Gloves, a gown, and a mask should be used when caring for the client, and hand washing is very important. The door should remain closed, but a negative pressure room is not necessary, so answers A and B are incorrect. MRSA is spread by contact with blood or body fluid or by touching the skin of the client. It is cultured from the nasal passages of the client, so the client should be instructed to cover his nose and mouth when he sneezes or coughs. It is not necessary for the client to wear the mask at all times. The nurse should wear the mask, so answer C is incorrect. 230. A client who is admitted with an above-the-knee amputation tells the nurse that his foot hurts and itches. Which response by the nurse indicates understanding of phantom limb pain? A. The pain will go away in a few days. B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. C. The pain is psychological, because your foot is no longer there. D. The pain and itching are due to the infection you had before the surgery. 230. Answer B. Pain related to phantom limb syndrome is due to peripheral nervous system interruption. Answer A is incorrect, because phantom limb pain can last several months or indefinitely. Answer C is incorrect, because it is not psychological. It is also not due to infections, as stated in answer D. 231. A client with cancer of the pancreas has undergone a Whipple procedure. The nurse is aware that during the Whipple procedure, the doctor will remove the A. Head of the pancreas. B. Proximal third section of the small intestines. C. Stomach and duodenum. D. Esophagus and jejunum. 231. Answer A. During a Whipple procedure, the head of the pancreas, which is a part of the stomach, the jejunum, and a portion of the stomach are removed and reanastomosed. Answer B is incorrect, because the proximal third of the small intestine is not removed. The entire stomach is not removed, as in answer C, and in answer D, the esophagus is not removed. 232. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating A. Fruits. B. Salt. C. Pepper. D. Ketchup. 232. Answer C. Pepper is not processed and contains bacteria. Answers A, B, and D are incorrect because fruits should be cooked or washed and peeled, and salt and ketchup are allowed. 233. A client is discharged home with a prescription for Coumadin, sodium warfarin. The client should be instructed to A. Have a pro-time done monthly. B. Eat more fruits and vegetables. C. Drink more liquids. D. Avoid crowds. 233. Answer A. Coumadin is an anticoagulant. One of the tests for bleeding time is a pro-time. This test should be done monthly. Eating more fruits and vegetables is not necessary, and dark green vegetables contain vitamin K, which increases clotting, so answer B is incorrect. Drinking more liquids and avoiding crowds is not necessary, so answers C and D are incorrect. 234. The nurse is assisting the physician with removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to A. Perform the Valsalva maneuver as the catheter is advanced. B. Turn his head to the left side and hyperextend the neck. C. Take slow, deep breaths as the catheter is removed. D. Turn his head to the right while maintaining a sniffing position. 234. Answer A. The client who is having a central venous catheter removed should be told to hold his breath and bear down. This prevents air from entering the line. Answers B, C, and D will not facilitate removal. 235. A client has an order for streptokinase. Before administering the medication, the nurse should assess the client for A. Allergies to pineapples and bananas. B. A history of streptococcal infections. C. Prior therapy with phenytoin. D. A history of alcohol abuse. 235. Answer B. Clients with a history of streptococcal infections could have antibodies that render the streptokinase ineffective. There is no reason to assess the client for allergies to pineapples or bananas. There is no correlation to the use of phenytoin and streptokinase, and a history of alcohol abuse is also not a factor in the order for streptokinase. Therefore, answers A, C, and D are incorrect. 236. The nurse is providing discharge teaching for the client with leukemia. The client should be told to avoid A. Using oil or cream-based soaps. B. Flossing between the teeth. C. The intake of salt. D. Using an electric razor. 236. Answer B. The client who is immune suppressed and has bone marrow suppression should be taught not to floss his teeth because platelets are decreased. Using oils and cream-based soaps is allowed, as is eating salt and using an electric razor. Therefore, answers A, C, and D are incorrect. 237. The nurse is changing the ties of the client with a tracheotomy. The safest method of changing the tracheotomy ties is to A. Apply the new tie before removing the old one. B. Have a helper present. C. Hold the tracheotomy with the non-dominant hand while removing the old tie. D. Ask the doctor to suture the tracheostomy in place. 237. Answer A. The best method and safest way to change the ties of a tracheotomy is to apply the new ones before removing the old ones. B is incorrect because having a helper is good, but the helper might not prevent the client from coughing out the tracheotomy. Answer C is not the best way to prevent the client from coughing out the tracheotomy. D is incorrect because asking the doctor to suture the tracheotomy in place is not appropriate. 238. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube was 300 milliliters. The nurse should give priority to A. Turning the client to the left side. B. Milking the tube to ensure patency. C. Slowing the intravenous infusion. D. Notifying the physician. 238. Answer D. The output of 300 milliliters is indicative of hemorrhage and should be reported immediately. Answer A. Does nothing to help the client. Milking the tube is done only with an order and will not help in this situation, and slowing the intravenous infusion is not correct. Thus, answers B and C are incorrect. 239. The infant is admitted to the unit with tetralogy of Fallot. The nurse would anticipate an order for which medication? A. Digoxin. B. Epinephrine. C. Aminophylline. D. Atropine. 239. Answer A. The infant with tetralogy of Fallot has 4 heart defects. He will be treated with digoxin to slow and strengthen the heart. Epinephrine, aminophylline, and atropine will speed the heart rate and are not used in this client, therefore, answers B, C, and D are incorrect. 240. A client with major abdominal trauma needs an emergency blood transfusion. The client's blood type is AB negative. Of the blood types available, the safest type for the nurse to administer is AB positive, A positive, B negative, O positive. 240 answers C. Individuals with AB negative blood, AB type, Rh negative, can receive A negative, B negative, and AB negative blood. It's unsafe to give Rh positive blood to an Rh negative person.